Hello friends, I am Ashish with you. I work as a researcher in Qatar, and I'm going to start a new series where we will be interviewing some healthcare professionals who are working overseas, and that includes Qatar. Through this series, my intention is to share some of the experience of the people who are working overseas and what they have achieved through their professional lives working abroad. In the first episode today we have Ms Divya. Ms Divya is from Bangalore. She is basically a nursing professional and she has completed her masters in nursing from Bangalore. One of the important thing I would like to mention here is that myself and Divya, we have attended the interview together for Qatar government back in 2012, and she was attending interview just before me. After finishing her interview, she was very happy, and she told that I got selected. And soon after that, I too attended interview, and the result was same for me as well. One of the important thing was that she was the only candidate in our entire batch who negotiated the salary with the Qatar authorities. Usually people don't negotiate when they got selected. Whatever they get, they are happy with that. And by learning from her, I also negotiate my salary, and we got, both of us got 20% or 25% higher than rest of the staff who were recruited at that time. So by telling this thing, I wanted to mention that she is very assertive. She fight for what she deserve, and this is very important quality of her. And because of that quality, today she is working as a clinical nurse specialist in one of the premier institution in Qatar. Though she has started as a staff nurse back in 2012. So this is really a motivating story for all of us, and I think without any further delay, I would like to request Ms. Divya to take us through her academic life first, and then we will move to the next question.
Really, you know, detailed introduction, and I think you're doing a really good job. I think all of us will be really motivated with your series, because people will watch different lives of the professionals, and there are a lot to learn. You know, everybody have a different experience. And talking about me, yes, I born and brought up in Mangalore, where I did my BSc nursing after my 12th grade. We call it as PUC there in Unity College of Nursing. After that, I have done work in Masood College of Nursing as a instructor, clinical instructor. And after that, soon after 1.5 years, then I moved on to pursue masters in psychiatric nursing. That I completed in Pandaraj Baldal College of Nursing. And then I worked as a lecturer in one of the College of Nursing. In between, I have done also counselor job, which was like my part-time job, where I was really interested in de-addiction clients, and also I took that opportunity, and then I worked as well. So including that, another after the post-graduation, I have done the PG diploma in counseling and psychotherapy, which was a distance course, but but it was very much helpful in terms of when I was doing this part-time counseling work. It was really helpful in that way. And after that, yes, you have told the story. In 2012 we got selected to Qatar, and I came over here as a staff nurse. And then I started my journey as a staff nurse, and I'm really proud of that, because I've learned a lot of things when you come to Qatar from nursing background with Indian experience. Definitely there is a lot of standard of practice difference from one country to another. And so as a staff nurse, I learned a lot, and it's the JCI, one of the JCI accredited hospital I'm working in. And where after 3 years I got promoted as charge nurse. And then once I promoted charge nurse, there was an opportunity for even nurse educator role, and I did that as well. And then after that, I worked as a head nurse. I led a unit for almost more than 2 years, where more focus on rehabilitation, focused. And it was a really good journey that time, and I led almost 30 staff nurses at that time. And after that, I applied for CNS post, and now I am as a CNS working with the really dynamic multicultural, where I'm working with many different professionals and multidisciplinary as well. And this is my journey. It is really fruitful to see that I'm moved from like a new nurse coming to Qatar to CNS role. Yeah.
Divya, like when you were working in back home as a lecturer, and you suddenly you have shift from academic life to the clinical roles. How that transition was? Is that difficult for you? Because many people back home might be working in college, they have very good experience and good qualification as well. But when the times comes of thinking to take a clinical job, they are little reluctant to go for that. So, how that transition was for you?
Yeah, anxiety is there because you are, of course, the things to do, how to do it, but when it comes to clinical practice, it is needed some experience for sure. It's needed because teaching something and doing hands-on doing is much difference will be there. But what happened to me was, like, as a clinical instructor, I was doing with the staff. I was working with our students, and I was demonstrating a lot of different competencies and everything. So there it was not so difficult for me to adapt. And I think when I came as a staff nurse, I was always be a role model there because I usually, you are aware of, like, evidence-based practice. We were promoting that, and I was vocal about it. And I think that helped me a lot because I came from lecturer. But I advise also for people to combine both of it, because when you are a lecturer, you'll prepare a lot of things, you'll read a lot of academic thing, but when you become clinical, mostly you will practice the same routines. So there should be a bridge between clinical and so you have both of the parties need to amalgamate, like together. You need to work hand in hand. If I'm in clinical, that doesn't mean that you have to routinely practice the same thing. You have to update yourself. You need to read the articles, things like that. But when you're a lecturer, you need to should not be only in teaching people. You need to have an opportunity at least once in a while, go and work as a nurse if there is an opportunity. So both things, because that will help. And your question was like whether you had really difficulty or it was. Of course, anxiety was there. Could I whether I will be meet that demands? But one more thing is the beauty of this country and Western country. Wherever you go, we have a preceptors. Preceptors, they'll help you to practice safely. They'll check on your competencies and everything. So, but I advise people to make sure that you have both exposure.
Very important takeaway from her answer, that back home most of the people thinks that those who are working in academic, they think that I am not supposed to go in clinicals. I'm not supposed to assume any role in clinicals, but that should not be the case. The best example is CMC Vellore, where there is a clinical staff and there is a bridge. Academic staffs are fully involved in clinical care, and as well in Father Muller. Because they take the assistant nursing superintendent roles, so those are working in college. So this is this should be happening in all institutions in back home, because this is what train our nurses, nursing education effectively. I think
in some of the hospitals, the policy doesn't allow, maybe because part-time jobs and all. But it's up to us maybe to find a place. For example, I did my counseling and psychotherapy, and I wanted to get exposure to work with the de-addiction patients. And when I was a lecturer, I couldn't do that anywhere. So I went to an NGO, which is in the Mangalore, and then I asked one of the lady there, can I work here? Then they were very happy to include me, because they never get a professional like us. So, and then my journey evolved there, and I still think that it's very important to brush up your skills, keep practicing those skills what you know.
Okay, Divya, when you applied for Qatar job, what were your thoughts? What exactly you were looking for, and you felt that Qatar is the best place for me, because I work in India for maybe 22 3 years now, and now it's enough. Now it's a time to change the country. So what was the trigger factor for you?
Actually, I was not at all thinking, and because your family is there, thinking a relocation and all causes really lot of
Lot of
anxiety.
troubles, yeah.
And how it will be. We don't know how the situation here. No one to contact. To I can't ask any. That time, no one was there here. My friends were not there in Qatar, so yes, it was not it was not in my mind. But one of the good man who was working as a colleague, I can say, he came up and told me that there is an opportunity, why don't you apply, and if you want to, you can just be there, and then they offer a lot of good money,
Package,
good
yeah.
package, and then why can't you, and it will, your life will be good, so then I thought, and I discussed with my family, and then my husband was very supportive, and I said, you try, if you want to, want to try, and then you want to successful in your career, just go ahead.
Go ahead, okay.
So that was the thing. But at the first, I was not having in mind that after my nursing, I will go to any of the countries. I will work here as a lecturer or something, where I'll advance my career in Mangalore.
Okay. So, but at last you saw the difference in package, and that was the main point to take the decision.
Exactly.
Is it? Okay.
Exactly.
So when you came as a charge nurse. Then
Actually,
as a
staff nurse,
You
yeah.
came as a staff nurse, and then you earn a lot of promotions. You went from you step up to charge nurse, and then head nurse, and then at the present CNS. So very easy for you, or do you feel that somebody is really working back home and has got very good experience, but he has to come as a staff nurse and then can look for promotion? So I just want to get some inputs from your journey, whether what you did exactly, what worked in your favor in order to get the promotions.
Yeah. The thing is, first of all, I like the word, the promotion is never in my mind. I think that I want to follow the excellence. Like, when I am sitting in one position, like I was staff nurse, I learned a lot of things. And then there were charge nurse working with us. So that is the next step where, because we have a career framework, and that was the next step to go forward for the administrative.
For the administration.
Okay, if not, we have to go to the clinical track. And for viewers, I would just like to say that we have a career framework here, where you would like to go, which pathway
path
you
you
want,
like to go.
nurse educator or clinical instructor role, or you can go for research. Like how you are here. We can also go as an administrative charge nurse, and that level, and the clinical track, where specialized nurse, clinical nurse specialist. So for me, at the beginning, because when you started the career, first people we can see is charge nurses.
Charge nurse, yeah.
And they give an opportunity to become like a in-charge nurse and things like that. So then it inspired me. I'm thinking like, okay, I can do this role. It's much management thing, and I have that capabilities. So why can't I apply? So I just applied, and there were so many people who applied also for that post. But at the end of the day, it's how you perform, how you present yourself,
Yeah.
presentation skills, how you perform, and your knowledge, your skills, everything matters. So I think promotion was not at all easy. Not everybody will get promotion.
Yes.
Because there is a concept that even our hospitals, people are thinking that when I get lot of experience, maybe 10 year, 15 year, I'll get promotion. It's nothing like that, because you have to show your performance appraisal should be good.
Yeah.
Like you have to achieve your goals, like a personal plus professional goals.
Yeah.
You should show some kind of interest in certain quality improvement activities, research activities, things like that.
Yeah.
So then when you show yourself, people are okay, you have that portfolio evidences supporting that you can do that role. Then definitely, why not? You can beat anyone coming in front of in the promotion this one.
Yeah. So just to sum up what she has said, first one is that you should be willingness to learn.
Exactly.
That should be that is the primary requirement of getting promotion in Qatar. And you need to do additional things. You need to have some quality improvement projects under your wings. You need to learn a lot from the environment which you are working
Exactly.
in, and then it's not you should focus on the dimension or the pathway that you are looking forward.
Looking forward.
As
exactly.
you mentioned, that there are clinical pathways, there are administration, and there is nursing education and research. So there are primarily four pathways that one can choose from and prepare accordingly. It should not be a blind attempt. We should have a vision, clear cut idea that where you want to land in next 2 years or next 3 years, and then prepare accordingly. As you mentioned, that promotion was not at all easy because the attrition rate in this setting is very low, and very few people are leaving the country, and that's why when it comes to the promotion, I think very few people getting chances to apply for the higher position. So you need to be very sure that where you are going to land, what is your pathway, and prepare accordingly, because if you miss that chance, you may not get the next chance. So it's very important that you prepare well, you decide where you are, which is your dream job, and prepare accordingly.
And some of the nurses I have seen my ward itself, like when I was working back then, they were very brilliant nurses, and some of them, they are very contented. They say that I do not want to apply for any promotion. They're happy with the work. So it's not that some people will look for some changes in their package and things like that. They want to achieve something in their personal life, so that also motivates. It's all about motivation, you know. If they're really motivated, and what you summarize is exactly what I said. I think people should go back to improve their skills and competence and everything, then automatically you will deserve any kind of promotion.
So Ms Divya, like now here you are working more than 8 years. So as an Indian female who is stepping out of the home, how was your experience? Like it's a new country for you when you land here initially. So was the transition from woman who is staying with a joint family and coming and assuming an independent role here, how difficult it was for you?
I think first of all, I would really emphasize that nothing is easy. Nothing is easy. Everything, you need to have a really good resilience to face any kind of stress and things like that, because sometimes you anticipate that this will happen on this particular day, but sometimes it may not happen. So when it comes to come out of that country and you stay here, you will stay in a shared accommodation. They'll provide a good accommodation, and then where you'll stay there, but you won't have your family for 6 to 7 months until you settle down here. And if you have kids, you have to leave them back in your country. Definitely that is additional stress. But when it comes to work, they'll be offering you support. If there is any issues, anything comes up, you can talk to your head nurse, you can talk to the preceptor. So there is a supportive element. But still, sometimes personally, you feel like, oh my God, what I have done. You know, there are some nights, did I do something right, or those are the moments. But it will pass on, and you need to build some network. You need to talk to people around you, and friends will, you will do. And I think it's not only Qatar, anywhere you go, it's obvious. And as you said, mother, and you're leaving your children, it's not easy, right? Definitely it's difficult, and we will think about that, like how to bring them and all of it.
So it was not that difficult. I mean, they were challenging, but you were able to cope up with that. But nothing, whether if you are moving from one city to other city in India itself, it's a stressful situation. So obviously you are leaving our country and coming back to the new country is stressful, but with networking, with good preparation, and with support from the managers or colleagues around you, it was easy for you.
And sometimes, like previously we used to get even the money. When it comes, you get salary, and you can clear a lot of debts, which back in the country we had that. I spent a lot of money for my education. I could clear that, and there are some simple happiness as well. So it comes with the pain and happiness. Both you need to
earn at the same time. And you pay a different cost for that as well. So Yeah, so but it was not that difficult if
Yeah.
you compare with the what talk is there back home, like it's very difficult country, it's very difficult to survive there as a female or as a male. It's like just for coming from India have more challenges, but there is
Absolutely.
nothing as such in real picture.
To be honest with you, I never been to any hostel. I never stayed away from my family.
Oh,
This was the first time when I
Time.
came, and then when I came to first time in Qatar, and they allowed me to a room, one room, and I have my personal big room and then bathroom and kitchen which is shared. And when I went there, I was completely, how can I live here without anyone? That came to my mind. But when I see people in my flat apartment, they were really supportive. Okay, don't cook. We have already cooked for 2 days. There was a support from them as well. So obviously it's not easy. Definitely it's not easy. So but you can, and everybody have a different experience. So we have different types of hospital. How they support. But for me, when I worked my hospital, it was superb experience.